go.
Great. Welcome, everybody, to the Delaware Center for Health Innovation, the Healthcare Workforce Learning and Relearning Curriculum. My name is Jacqueline King. I'm a practice facilitator with Health Teamworks, and I'm here today to talk about our second module, and this is the pre-work webinar for that module. I just want to do a quick review of the module topics that we have identified for everyone. So the first module that's been completed was on performance management, really focusing on quality improvement and performance improvement tools and processes to help get your practices up to speed and driving improvements in your clinic. Our module is what we're focused on now, the population health management and health IT enablement. I'll talk more about the details of the current module in just a minute. The module is interprofessional practice. So this would include getting the most from your team, really thinking about working to the top of your licensure and optimizing those team roles. And a large component that will be focused on behavioral health integration, which is absolutely a highlight to make sure we take care of our patients' social, emotional, mental health needs. The fourth role listed here is team-based care coordination. So again, this is looking at building the team and really making sure that your clinic workflows optimize use of all team members. Specifically also focusing on care transition management, so following up from hospital and emergency department visits and taking care of those complex or high-risk patients. Module is patient and family engagement, so focusing on cultural competency, engaging patients through health IT, so thinking specifically about how we can use our portals for that engagement. There's quite a bit of content about health literacy and communication and counseling skills. So regardless of some role within the clinic, it's always helpful to enhance our patient and family-based skills. And last module will be business process improvement. So this, again, is really looked on value-based payments and preparing and or engaging in new payment models, depending on the future of care landscape. So I just wanted to review those module topics. We will continue in that format. And then within each module, the following curriculum format. So there's a pre-work webinar for every single module, and in-person training and follow-up community learning calls. So specifically, the pre-work webinar is what we have today and you're listening to. It will really introduce the module and kind of present an overview of the schedule, what to expect. Let's introduce there's a bit of background noise. If you could just mute yourself, thank you. Our schedule, offerings, and then the faculty and presenter staff as well. We'll spend time introducing the content for the in-person session, and we'll go into that in just a minute. And there will also be pre-work for the in-person training. So that's what we will focus on today. Brad, the second aspect of each module curriculum is the in-person training. So that's a full day meeting with really 2/3 components, one of which is that simulation exercise similar to what occurred in the first module, and have real-time practice transformation strategies. So you'll get to hear from experts in the field and get to gain knowledge and skills, as well as have plenty of time to work within your practice or work on your, in this health IT enablement with the content experts in the room. So that's the focus of the in-person trainings. And as usual, there's the follow-up community learning calls. These are typically a series of 4 webinars on a specific topic related to the module itself. And we have action activities between webinars. So I encourage you to take the knowledge and best practices shared on the webinars and strategies in your practice. Specific to Module 2, you'll have that follow-up access from a content expert from in-person training, which is really a huge asset and a value for you all to do that deeper dive. Okay, talk a little bit more about our current module. We're in Module 2, as I had mentioned, the population health management and HIT enablement. To speak a little more about that, it's really focused on understanding really the health needs, services, and outcomes of our entire patient population. So what we mean by that is not just patients that come in for regular visits, but patients that are accessing other services, patients that are paneled or attributed to us as primary care providers and practices, and yet we're not seeing and aren't getting their health needs met. So I understand our patient and family population and help manage their health. We need data. We health IT or HIT, and helps us allows us to understand our patients, not just clinically health outcomes, but also the right services using evidence-based guidelines, as well as social and emotional health needs as well. So this model will really focus on how to enable our health IT resources that are available to us, them in an optimal way, and make meaningful changes to provide the best care at the right time for the right patients. So I had mentioned that the last component of each module in the curriculum are the community learning calls. See here on the screen the schedule for Module 2. Save the dates. I know that a lot of this information has been sent to you, and we will repeat it in the in-person session, but it's always helpful to hold your calendars. So first, community learning call will be June 15th. This is going to be, again, a follow-up to the in-person training session, specifically around the Delaware Health Information Network. So Lakeisha is on the phone today, and we'll transition to her in just a minute. And you'll have an opportunity to really understand how to use the DIN services deeper level within your clinics. Community learning call will be June 29th, and this is a great follow-up opportunity for folks from the in-person session. So Doral Jacobson, who will introduce herself in just a moment, is going to be talking about how next steps and how to use the UR reports on a deeper level. So it's a great opportunity to get a brush in the in-person sessions and then dive deeper on these calls. I will be facilitating a webinar about population health management specific for pediatric practices. So again, in the in-person session, we will talk quite a bit about how to enable data within a PEDS, family medicine, or internal medicine realm, but it's always helpful to dive deeper into pediatric practices, since data can be different in terms of population health management, and I'll be facilitating that. And the community learning call will be July 27th. We'll be with Jennifer Boaz, who works here at Health Teamworks. She's a clinical health information advisor, so that she has a lot of experience in working with clinics about how to optimize the use of EHR. So I want to just let you all know that it won't be specific to an EHR, but rather generally how do you optimize the use so that way you get the quality data you need to be able to take care of your population. Before we transition to our first co-presenter. Great. Right now is we'll pass the ball over to Lakeisha Moore. She works with Delaware Health Information Network. So feel free to take it away, and if you would like me to advance your slides, just let me know. Otherwise, you have the power to do so.
Great. Can you guys hear me okay?
Thank you.
All right, great. And we'll see, I'm thinking that this is just a click to advance slides, but we'll okay, I see it. We'll work through it here. So thanks everyone for joining today. I know there were some challenges getting connected, and I told Jacqueline and the team, I totally understand. There are many times that we plan things out to what we think is a T, and then you get ready to go and use it, and you're like, wait a minute, it's not working as I planned. So glad that everybody was able to get connected and we're able to kind of talk broadly about some of the things that we'll be going over when we meet in person a few weeks from now. So this really is just kind of broad brush what we would like to cover during our in-person session, and then, of course, a lot of the tools and resources as you get ready to implement some of these tools and resources. Absolutely reach out to me or Sarah or Jacqueline, and if you need to get our contact information, of course, we'll also be in person to give you guys that contact information. But even after today's session, I apologize, I don't think I put my email address in here, but of course, Sarah and Jacqueline, if you have a assigned in relationship manager, you can kind of follow up if you have additional questions. So two big objectives for person session that's coming up, and one that's to describe how the DIN products and services can align with whatever measures you're working on, be it measures that has been identified through the state innovation model, so that's the SIM, and y'all keep me honest when it comes to the acronyms, because sometimes I'll kind of throw them out, forgetting that, there's a lot of acronyms out there. So I'll try to make sure that I explain those, but of course, if you have questions, let me know. But the Delaware State Innovation Model, we've got practice transformation measures that maybe many of you may be working on. And then, of course, you may be involved in an ACO. And so maybe you're working on measures there. But you'll kind of see how a lot of the products and services that we're developing, or that you kind of said, hey, we need some help with this, align with whatever metrics or measures you may be working on. And then the second objective is just to learn how to use the different products and services that we do have available in order to achieve your practice transformation measures you're working on, and then, of course, overall improve patient outcomes. So let's kind of talk about just, because a lot of times, even with those practices that are enrolled in the DIN community health record, and practices have many different needs depending on your specialty. And so one of the things that we found as we were kind of looking at the different measures and milestones is that there's a lot of crossover. And so even with the state innovation model, that's milestones and measures. That's a little tongue twister there. But even with the SIM measures, the 9 milestones that we identified, we recognize that there's a lot of crossover. So this slide is just kind of showing that, whatever measures you're working on, many times a lot of those same resources and tools kind of tie and work with other measures. So I'm going to focus on kind of the ones in the middle, but just kind of keep an open mind that if you're not specifically working on, maybe primary care measures, or you're working on something else with ACO, that many times a lot of the services that we have available do kind of cross over and can be utilized for whatever measures you're working on. That kind of brings me to my last slide, and this is where I'll camp out, and this is where we'll also do a deeper dive when we're in person in a few weeks from now. When you look back at the state innovation model milestones, it's 9 milestones that are identified, and once again, we'll go deeper into those in person. But some of the services that DIN offers that helps with the different milestones or measures include what we call event notification system, or ENS. ENS essentially will give your practice an alert anytime one of your patients has an encounter in any of the Delaware hospitals, the Maryland hospitals, the DC hospitals. We're also now enabling urgent care centers. They send us alerts anytime any one of your patients has an encounter in the urgent care. We're also in the process of enabling long post-acute care. So the Genesis facilities that are in the state of Delaware, they will be sending us alerts. So basically anywhere that your patient has care done, that's a great way for you to be alerted. Hey, my patient was in the ED, and now you proactively can reach out to them in order to schedule a follow-up visit or find out what was going on with them. So ENS has definitely been a service that we have been enabling more. And I will say that if your practice has not signed up for it, or even if your practice has, please let either me, Sarah, or Jacqueline know that, because we'd love to share some of those testimonies during the in-person session. Because I know a lot of practices kind of wonder, how is that working real time? Is there one person that goes and kind of checks this? You get basically a spreadsheet that will come to you daily. So I think just sometimes the practical application for ENS has been a challenge for some of the practices. So we'd love to hear if you're using it. If you could share that, we'd love to kind of do just a quick testimonial from you that we can share in the in-person session that could possibly help other practices as they get ready to enable that service. So event notification lets you know pretty real time. You get a spreadsheet every morning by 6 a.m. The spreadsheet will tell you any encounters that your patients had that day before, the 24-hour period before, and then you can come up with a process of how you're going to follow up with those patients. So that kind of also touches quite a few of the different milestones, and that measures is continuity of care documents, or what we call CCDs. So those are care summaries that are many times automatically generated right from your EMR. And we have about 107 practices in Delaware right now that are automatically sending their care summary documents into the DIN community health record. So that definitely helps with coordination of care. If you're doing any types of MIPS improvement activities, this can be one of them for you, where right now we actually have a grant that covers the cost of implementing CCD. So if your EMR vendor does charge you for that, that's something that we could cover under the grant. That's only up until July. So if you're not connected already in sending CCDs to the DIN Community Health Record, once again, please reach out to us, let us know, because we'll definitely try to get you on board with that, but while we still have grant funding to cover it. But that definitely can help when it comes down to coordination of care, because now other specialists can see that encounter that that patient had with your practice. We're developing an analytics platform at DIN, and that has been definitely contingent upon feedback from your practices. Most of the analytics reports that we have available right now have been specific to some of the hospitals. The hospitals have said, hey, we really need some readmission reporting, but we are starting to dive into more practice level analytics, and many times that does require your CCDs, those continuity of care documents, to really help tailor those reports down to your level. We'll do our next session on June, I believe that's the 15th session, and we'll just talk about analytics, because that's a new project for us, and also just a new platform that we're using for analytics. That's something that I think it would be a good time well spent to kind of see what we have available and what we've heard from some of the practice transformation organizations and from your practices, what you're interested in learning a little bit more about when it comes down to your practice level metrics and how you're doing, and being able to pull it in a real-time format. Direct secure messaging is something that we offer really just as a, if your EMR vendor doesn't already offer it, because what we're finding is a lot of the EMR vendors do. Direct secure messaging is essentially secure email. It is the format that the ONC recommends each of us to use as we're passing along patient information or communicating about patients. So if you don't have that available in your EMR, that is a service that DIN provides for free for your practice. So of course, let us know if you need some type of secure messaging platform. That's something that we do offer to your practice. And lastly, just kind of a broad other DIN services. We recently, under this last grant that we have acquired, developed a personal health record. So we're piloting that with only a couple of practices right now, but the personal health record essentially is like an extension to your patient portal. Many of you that have been on the DIN Community Health Record for years recognize that it's the HR, what we call for short, has been available just to healthcare professionals in the past. But if you're looking to enhance your patient portal and maybe say, hey, when patients log in, instead of having to go to your specialist to get this report and go to their portal to get this report, and you got to go to your primary care to get this report, to really be able to access all that patient data through your patient portal by connecting to the DIN personal health record. It definitely gives your patients a much more robust information versus having to manage 7 or 8 patient portals. We're developing that connectivity. If you already have a patient portal, we can connect to your patient portal and pull in the information that's available on that patient from the DIN Community Health Records. Once again, that's something that we've only got right now 2 practices that are piloting that, just kind of working out some of the logistics there, making sure the connectivity is working as intended. But if that's something that's on your radar, you're looking to kind of ramp up more, just more communication with your patients, the personal health record is something that that we have now developed, and like I said, is in a pilot stage right now with a couple of practices. So keep it in, on your radar if that's something you're interested in. Lastly, just some of the other DIN services deal with consumer or patient engagement. So we have MD Live, which is a partner of DIN. Now, if you need telehealth services like to provide after hours care for the state of Delaware, or in their in their agreement with DIN, they are offering their services at a discounted price. So if you need a telehealth service, then that's something that definitely you could reach out to us and let us know if you're interested in a service like an MD Live. And then Impulse, which we're going to call Health Check Alert, is essentially, we kind of put the personal health record or PHR. That's also another product that we're piloting specifically right now with Medicaid, but it is something that if your practice is interested in implementing, we could definitely work with your practice on doing so. But Impulse essentially gives patients an alert when they've had results come in or an encounter come in, a lab come in. It also alerts the patient that that lab is available for viewing and can many times even increase if you're looking for, once again, more of your patients to be involved with their care by driving them to the patient portal. It could alert them, and that would to go into your patient portal and to look up that particular lab. So those are kind of the broad consumer-based products that we're looking to develop. This is honestly our first time going into that market, but we recognize with the way a lot of the measures are going, looking at that last slide we looked at, that definitely patient engagement and what we call patient, and then kind of moving them to consumers, because that's really the difference, is consumers are those that are really involved in their care and want to be able to do more with their care. We're trying to also develop tools that help your practice, help assist in getting patients really connected to their care. So I know to go over, but definitely during our in-person session, we will do deeper dives and really look at some models. Bring your laptops with you. If you haven't been in the DEN Community Health Record, we'll have some of the DEN relationship managers there to kind of help guide you through how to look up information in the Community Health Record, and you'll have a chance to see a lot of the products that I just went over here. I want to just save it to the end for any questions, or if you have any questions, we can go over this now. Jacqueline, and Sarah, I'll leave that up to you if you want to just wait to the end, or I can open it up now for questions.
Sure. So what we can do is, if there are any pressing questions, feel free to either type it into the chat or ask verbally. But as Lakeisha gave a very well statement, this is just an overview. So feel free to ask any questions right now before we transition to the next section.
I feel, she's a big, part of it. And just, are worried about her reading. Her research is ending.
Yeah, maybe, I don't know if they can mute.
I think perhaps muting. I wasn't sure if that was a question. All right, what we'll do is we'll take any questions that come through the chat and then have time at the end also for questions. Because I don't hear any at this time. Thank you so much for that overview. So Heather, if you could just pass the ball to Doral, and Doral, I will let you describe a little bit more about your sessions that will be happening in in-person training on June 7th, and feel free to introduce yourself. We're going to queue your reports.
Great. Thanks, Jacqueline. My name is Doral Jacobson, and I'm with Prosper One. We are a specialized consulting firm out of Asheville, North Carolina, and we work a lot on value-based contracting, reimbursement, and data analysis. And I'm really excited to present this session. Looking forward to meeting everyone. And I want to talk a little bit about our learning objectives. And then I'm going to talk a little bit about the homework, if you will, the data that we would love if you could obtain and bring to the session so that it will inform our deep dive session. In learning objectives, we're going to be reviewing payment reform and tying that into reimbursement methodologies. We're going to examine the existing methodologies and then work our way up the ladder from a value-based reimbursement perspective so we understand how the data can inform each of those methodologies and understand how we can use the information in order to make decisions about what models might be applicable to practice, what reimbursement methodologies may be of interest based on the information we have, and then hopefully with information that we examine, give you some insight into what might be possible based on the information that we'll examine. Hopefully, even looking specifically, you can be looking at your practice data. That's the first piece. Then we are going to move into a deep dive regarding data in and of itself, specifically quality and resource use report data. And quality and resource use report data are data files that you can download from the CMS portal, and I'll talk about how to get that more in a minute here, that is associated with the Value Modifier Program. And the QR data is really comprised of two composite scores, quality and cost. And the very interesting thing is that this kind of cost data, we really haven't had access to this kind of data really ever on the physician side. So there's a lot of information. There's some summary reports, and there are many Excel tables. And during this section of the training, I'm going to share with you what each of those tables mean and give you some action steps relative to you can look at this table in this way and understand this about your practice. So it'll be a very tactile learning session. And we're going to use the information on reimbursement models with our data dive, understanding what we have available, and tie that into development of a value proposition. So really understanding how to leverage that information in order to articulate your value. And we'll talk a little bit more about how practices are using that. And I'll be bringing lots of real-world examples to life during our session, both for practices that have QR/UR data and those that don't, so that we can learn about leveraging that information, for various reasons. Okay, so let's see, that's my slide.
So there's little right and left arrows just above your slide. If you can't, I can always advance them for you.
Gotcha.
Just click the right arrow. There you are.
Oh, could have been easier. Thank you.
Of course.
Once you see it. Okay, so if you do not have a QR/UR report currently, you'll need to potentially set up an enterprise identity data management account if you don't already have one. And we have some deep reference tools that I believe you can download that will walk you through that process. Now, part of this EIDM setup is to select a role, and then you have to move to a remote identity proofing process and can elect additional security with a multi-factor authentication process, which will include the registration of a device, a PC or a phone or what have you. So you have to make sure that that is set up before you can proceed with the next piece. Things to keep in mind in setting up your EIDM, that there are security questions that can be a part of this process, and the questions have time limits. So I have found to be very important is to set aside time that's uninterrupted. So don't do this during lunch. I believe the ticker can be as short as 10 minutes, and so you need to find some information. It'll log you out, and you have to kind of go back to the beginning. And then the other piece is, of course, tracking passwords. Some of the biggest issues that we've come across with our clients is that they have to go back through the entire process because there's no information regarding what the password was, so that can be problematic. So make sure that you have a way to keep track of that information as well. So that is step one in obtaining a quality and resource use report. Once you've completed that, you'll go to step two, which is actually downloading the information. And what you'll do is you slide on to the CMS portal, and then you'll pull down your summary tables and your reports. And you'll see that usually you'll have a selection based on the size of your practice for what you can download. And there are mid-year reports and there are annual reports that have tables and summary information. So pull down what you see is the most recent information. I believe it's just the annual reports at this point in time. Now, something I will mention here is that be careful with your browser. CMS recommends Explorer 10 or 11, or Foxfire. And we have definitely had issues with folks trying to download it using other browsers and not being successful. So that's one piece to keep in mind here. Adding other data, it'd be helpful you can bring with you any profiling reports that you might have. And I've listed a few here, but what we really want to do in the section on value proposition is dive into what information you have about your practice relative to outcomes. And I will be providing examples of how practices have used these different data points in contract negotiations, in recruiting conversations. So any kind of outcome data, and I've listed a few examples here, be helpful, and we can talk about how you might employ those. I think that's about it for all that we were going to talk about today. Very much looking forward to our deep dive session and sharing a lot of information with you about data and how we can use it, and then tying all those things together with our transforming environment. And very much looking forward to meeting everyone and talking more about this. And I'll pause here for questions and next steps, Jacqueline. I'm not entirely sure how we want to proceed, but I'll hand the ball back to you.
Thank you so much. So I'll just, if you have any questions, just 1 second, we'll transition to those in just a minute, and feel free again to type them into the chat if you have any, and make sure to select all participants and attendees so that I can see them. So Lakeisha and Dora did a phenomenal job setting us up for our in-person on June 7th. Like they mentioned, we'll really have an opportunity to have 2 sessions that are really focused on a broad overview, kind of diving deeper in terms of information, and that way you will have the knowledge you need to know what's available to you. We'll have working sessions. So specifically, Lakeisha lead one and Doral, so you have a chance to really have the right knowledgeable experts in the room understand how do I use my data and how do I effectively drive improvements and changes in my clinic. So please, just a few things that you should bring to the in-person learning session are your QRU report or other quality reports, specifically for pediatric practices. It'd be really helpful to have those available and ready to go, so that way when you're in the working session, you can use that to proactively identify the changes or areas that your clinic would like to improve on. So as Lakeisha had mentioned, please bring your computer to the workforce development training. Of course, the plug for it, so that way you can power into an outlet throughout the day, since we will be spending quite a bit of time actually working within and using these reports specific to your patients and specific to your practices. That's essential to have. And bring your binder from Module 1, so you have all those resources. We will provide you with a lot of additional printed resources that you can insert into your binder, but it is essential to have that Module 1 piece as well, because we'll be building on a lot of the Module 1 topics at the end of the day. Open up now for questions. We can either open the phone lines, so if you'd like to verbally ask a question, please do. And if not, there's a few things in chat I just want to call out. If you haven't already, just please confirm with Sarah if you're going to attend, or whom from your practice is going to be able to attend to the in-person session on June 7th. You can simply just say, yes, you're going to her, send her a quick message. Her email's at the end of this slide as well, just to make sure we have you counted for. We'll email these slides once the webinar is completed, and we'll send a link to the recorded webinar, as well as the 2 reference guides that Joel had mentioned. They're currently available actually at the top tab of this webinar. So you see QPP existing and QPP new. But we will send both, so they're reference guides of whether you need to create a new account or you have an existing one. Any additional questions via the phone line for either Doral, Lakeisha, myself? Okay. Mary Ann looks like she asked, you'd asked us to quality reports for pediatrics. We're going over primary care reports as well. Dora, I'll let you answer that question, but I'm fairly certain the answer is yes. So do you have anything you'd like to expand upon?
That's a really great question. I'd say if you're wondering if you should bring it or not, go ahead and bring it. And we can take a look at the primary care reports, pediatric reports, any kind of outcome information that you might have relative to information you might have from payers, cost and efficiency reports, any payer ratings, information that you might have from your hospital partners relative to how your practice compares to others in infection rates or length of stay. Anything around those topics would be good to have. I'd say bring it. If you're questioning, go ahead and bring it because it may be useful. But then wish we had.
Think on that. All right, well, no other questions. I really appreciate your time today. And I just want to provide our contact information. So as most of you probably have, there's Sarah's email as well as myself. So feel free to ask any questions you have. If not, we will see you all on June 7th. The day right away 9 a.m. and there's arrival time from 8:30 to 9 to get settled and just find the facility and everything. So please feel free to earn time and bring those laptops. Don't forget, as well as your module and binders. The event itself, Sarah was kind enough to send out an agenda and a map, but it's a corporate training center at the Del Tech Terry campus in Dover. So if you have any questions specific to that, please direct them to Sarah. And don't forget to save those dates for those community learning calls. We'll also be providing information and reminder during the June 7th in-person learning session. So thank you very much, everyone, for your time, and we will end the recording and end this session.